If you are watching this video, that means you had an incision or something and you want to know how to take care of it. Today we're talking about general wound care. If you have a closed incision, for me, 9 times out of 10, you have Dermabond over it. Dermabond is super glue. Dermabond allows you to take a shower immediately after surgery. It's waterproof for 48 hours. Potentially you could go swimming, but I don't recommend it. Nothing really to do for the wound, just let it hang out for about 14 days. Now, after 14 days, if you want to get the glue on and it's gotten dirty, you can put Neosporin, Polymyxin, Vaseline, any type of petroleum jelly on it, leave it on there for 5 minutes and it'll come off. If you have Steri-Strips, little pieces of tape over it, leave those in place. They'll fall off around 10 to 14 days. If they don't fall off, again, some type of Vaseline or petroleum jelly, it will fall off with that. If you have staples in place, sometimes we put Dermabond over them, sometimes we don't. Staples are hard to deal with sometimes because they can get caught in your clothes. If you have staples over your incision, what I usually recommend is put a gauze over it or put tape over it, not because you need it, just to, after 48 hours, just to protect your clothes so it doesn't get snagged. Any dressing that is over an incision after surgery comes off after 48 hours. If you have a JP drain, you want to put a gauze over the end of it where it goes into your skin just to protect your skin. If you have an open incision, we'll talk about wet to dry dressings. That's in another video, but for the most part, you'll pull the dressing out at 48 hours and put a new one in every 24 hours when you get in the shower. That's pretty much a brief overview of wound care. If you had a specific surgery, let us know and we'll talk about it. Or have any questions about it, we'll talk about it. But pretty much that covers just about every wound. Oh, except for one, forgot that. If you have a big open wound, we'll go over wet to dry dressings a couple of times. If you have a wound vac in place, we'll go over wound vac care in the office a couple of times. Those wounds are very specific, so nothing to address here. I'll put some general comments up here, just kind of stuff you need to know about if your wound has any problems, when to go to the emergency room or give us a call. But realistically, if you have any questions, give us a call and let us know. All right, guys, take care, and thanks.